Actually, when I was in my teens, I developed an illness that sort of took me away from school and hospitalized me for quite long periods of time. And it was, so I had that interaction with the medical community from the patient point of view very early on, and it was kind of frightening and painful at times, and said, boy, I want to be away from this. I don't like this. I don't like hospitals. I don't like doctors. From that perspective, having been on the other side of things, it does give you a very strong and a much clearer perspective on how people are experiencing illness and suffering, and you can empathize much more with that. At least I can.
You know what? Some doctors are very cut and dry, to the point, and Dr. McKercher's not like that. So I say he takes his time with people. He'll answer any questions that they have, and when they do leave, you know, he wants them to have that control and have that care plan and know what the next steps are.
He is not only a gentleman, but he's a true gentleman who is approachable. He's a joy to work with. He's very supportive and caring and kind.
What I really enjoy about the work, I think, is the teamwork, the interdisciplinary work with other clinicians. Really kind of buoys you up and keeps you going, and you know, gives you that extra energy and drive to go on.
Most people do recognize his name, and just in saying that, it actually brings them some comfort, and they seem a lot more willing to participate in some of the assessments. And it's just remarkable to see the number of people that actually recognize his name or know him.
A lot of times patients and families ask for him specifically when we get referrals to our service. So as a nurse, I'll go out to the patient's home and do an initial assessment, and that's one of the things that they ask specifically is, can you make an appointment with Dr. McKercher?
A huge component of the work that we do, and the work that the Behavioral Supports Ontario team does here, they really focus on the person's personhood, as it were, getting to know the person, because it's incredibly helpful and important when we're trying to offer them care or understand where they are now. So where did they come from? What things have shaped their life and their response to life now when they're getting older and perhaps disabled and having difficulties with memory and interaction with their environment.
He's not just, I think, a physician. I think he's a human being who cares genuinely about the seniors in our community. And so when he's working with them, when he's helping them, he wants to make sure they have 100% of his attention and his compassion as well. And that they receive the best possible service and care plan that they can receive.
The effort that he's putting forth is actually very appreciated, and people are noticing. I'm
the quiet person working in the background, but I continue to work and advocate for people and again work with others and teams to be able to make that happen.